Hello, everyone. My name is Jared Helms, and today for my presentation, I'm going to be talking about the Women's Health and Cancer Rights Modernization Act of 2025. I'm looking forward to seeing all of your guys' presentations. And so to get into it, for disclosures, I am not affiliated with any of the institutions or organizations that could bias my perspective or that I discuss here. No conflicts of interest. Trigger warning, this presentation does discuss breast cancer-related topics, including treatment, mastectomy, and some complications. So to start off, the foundation for this new act was laid by the Women's Health and Cancer Rights Act of 1998, which was a federal law requiring insurance policies that cover mastectomies to also cover reconstructive procedures, prostheses, and treatments for related complications among breast cancer patients. So medicine has changed and evolved since then. Insurance coverage, unfortunately, has not. This has resulted in denials, delays, and limited coverage among women with breast cancer, which leads to poor health outcomes for survivors. So surgical techniques have expanded, and we want to cover those. So this new act, introduced in October of last year, was introduced to the House of Representatives. It remains there as a federal bill, has not moved since then, but would enact some great policies if passed. So what this does is it will close loopholes utilized by health plans and insurance companies that deny coverage of breast and chest wall reconstruction following mastectomy or breast cancer treatments. So increased coverage would mean increased health outcomes for these survivors and these women. So again, and this would also improve health representation for women. Women's health topics are drastically underfunded and overlooked, under-researched and underinsured. And so by increasing coverage and increasing policy, that would help these issues. So who must comply with this act? If passed, federal policy would require both group and individual health plans to offer additional reconstructive options and other additional support among breast cancer patients. So what is added to coverage? Under the Modernization Act's new language, accessibility to new reconstructive procedures increases significantly after receiving breast cancer treatment. So that's immediate or delayed reconstructive surgeries, and also future surgeries that might not exist right now would also be covered. So if passed, this policy would require insurance companies to have at least one in-network provider per procedure type that's covered. It would make they would have to make coverage decisions with a doctor and patient and inform the policy holders of their rights among these treatment options. So breast cancer is the second leading cause of death among women in the U.S., the most common cause of cancer deaths among women worldwide. Survival rates have increased dramatically in the last 100 years, but that is a result of health coverage and procedures that many people don't have access to. So by eliminating loopholes and mandating coverage, we can increase health equity and make sure that more women survive and feel great, or not great, but feel better about their health and their lives afterwards from these procedures that would be covered. So this act again aims to modernize rights for breast cancer patient survivors, decreases financial obstacles receiving care, and increases choices for treatment options. It prevents greedy and exclusionary practices among insurance companies. That is all I have for you. Thank you so much for listening, and have a great day.